problems?
Just broke my ankle.
Do you have any surgeries that you've had?
Just with that, my ankle.
Alright, and then I would document this information, and if I see something that's really serious or abnormal, I'd notify a physician right away. Next, I would get my patient's vital signs, such as the blood pressure, temperature, pulse, rate of respirations, the height and weight, and I would do the visual acuity. So I have my visual acuity chart right here. Cover up your left eye and your right eye. Can you see all the small numbers?
No.
Okay. Then I would document what I got from the visual acuity. I have a scale here. Will you take off your shoes and step on my scale for me, please? Okay, and then I would document and note what my patient's weight is, and then I'd have her stand against the wall, or I'd take the height of my patient from the scale, and then I'd note it down on a piece of paper. And then next I will take my patient's blood pressure, and I will ask, have you ever had any mastectomies? I will make sure that her feet are flat on the floor and uncrossed. Make sure that I have the right size blood pressure cuff. I place it properly right over the brachial pulse. Make sure there's no air in it. Make sure that this is closed first, and then, or opened first, and then I would close it all the way. I will use my stethoscope. Warm up the diaphragm. Place it over the brachial artery. I would previously check her past blood pressures so that I can take them and compare them. (120/72). I would make note of this, so I don't forget it. And then next, I will take her pulse. And I will check her pulse for 15 seconds and multiply that times 4. And if it's abnormal, I would take it for the full 60 seconds. I will make note of this. And I will take her rate of respirations at the same time I'm taking her pulse. When I'm taking her blood pressure and pulse and all that, I will make sure that there's no sounds around me, no TVs on, no radio. And next, I will have my patient have a little privacy so they can slip into a gown. And then she slips into her gown. And then I will come back and I will check her face, skin, chest, arms, all this stuff. I'll check her head, look her over, note her skin, make sure that her skin's dry, warm, intact, no lesions. And I will check her heart sounds, auscultate the heart. I'll check the apical pulse and listen for the S1 and S2 sounds. With the bell of the stethoscope. I would note if there was any abnormal sounds such as murmurs. Make sure that everything sounded right. The apical pulse, the apical rhythm and rate was normal, within range. And if not, I would notify the physician. I would document all this. And then next, I will listen to her respiratory sounds, auscultate her lungs. I have to turn around and check her back. And I will check her capillary refill. And if it takes longer than 5 seconds, that is abnormal. And next I will check my patient's pupils to see if they dilate and constrict the same and normally. I would note that they constrict and dilate as they should. Next, I will ask my patient to go and lie down on the examination table. And I will auscultate her bowel sounds in all 4 quadrants for at least a minute. And next I will palpate and do percussions. I'll palpate to make sure that the skin is soft, there's no distension. That what her stomach feels like. I'll do this in 4 quadrants. Then I'll do percussions to check if there's any excess gas or tenderness. Does this hurt? Good. Then I would check her genital area and her anal area to make sure there's no open sores, any redness, any breakdown. And I check her skin on her legs, make sure that there is no lesions, make sure the skin is dry, intact, warm, cold. I'll check the ankles for any edema. And then I will check her peripheral pulses, make sure that they're even and they're at a normal rate. Then I will have my patient push her soles of her feet on my hands to check her neuromuscular reflexes, which are even. Then, next, what I would do is I would obtain any specimens, urine specimens, bulk stools, any blood samples. I would inform my patient on the proper way to obtain these samples. And I would wash my hands, document. I'd ask my patient, do you have any questions or concerns? And then I would notify the physician of any abnormal or serious findings. Thank you! Thank you for being a good patient. Here's your sucker.